At the Capitol tonight, medical coverage is expensive and not always transparent, leading to bills that take many of us by surprise.
And to make matters worse, not all insurance copays you pay when you see a doctor or get some medication count toward your yearly deductible. We have a warning. Some people may find this video disturbing. Al Myers has more from Lansing on new legislation being introduced this week to change all of that.
The cost of medical treatments and medication certainly aren't going down in Michigan, but one state lawmaker wants to make sure the money you shell out for copays is getting counted towards your deductible.
I've experienced a lot of tears and anger finding out by a phone call saying I owe a $12,000, $5,500 payment for these drugs out of nowhere.
That's Emily Schaller, who joined State Representative Carrie Rheingans on Tuesday to introduce legislation that would require all copays for medical treatment to count towards a patient's deductible. In some cases, nonprofit organizations and even drug companies help patients pay their copays so they can afford their medications and treatments.
Unfortunately, a growing number of insurance companies and PBMs, or pharmacy benefit managers, are using copay accumulator adjustment programs that prohibit the value of this copay assistance from applying toward a patient's deductible or out-of-pocket maximum for the year.
This trend, advocates tell me, can be devastating for people with high deductibles and expensive medications or treatments.
You have to remember, cancer patients are not just on one medication, they're on several. They see several physicians. So not only that, it's accumulation of things. So it's very stressful upon patients.
Legislation that tackles this issue has been introduced in Michigan before. In previous attempts, it passed the House but stalled in the Senate. Rheingans says she's optimistic this time around. And Schaller tells me it would be a huge relief if it can get across the finish line.
I wait to fill my prescriptions because just the anger and frustration and sadness that comes with getting told you owe this much money. It'll be a huge relief for myself.
I reached out to 3 health insurance providers here in Michigan, but none were available to comment. For now, reporting in Lansing, I'm Al Myers, CBS News, Detroit.